I was told once very, very early on in my dental career, focus on the patient, the money will follow.
And so I want to just ask why such a focus on, like, why do you think patient experience, it seems like you kind of view that impacts everything. It bleeds to all areas, right? That's kind of the golden thread that connects it all. But why? Why is patient experience so important?
For me personally, it's one of those situations where I feel like a patient, like if I can take the best care of the patient, that's all that matters to me. When they walk into my practice, they're walking into my home. That's how I wanted my practice to feel. You're coming home. I want it to be comfortable. I want, I just want patients to feel comfortable and at ease. Many people have said, if it was your family member in your chair, how would you treat them? And to a certain respect, when I have a patient in the chair, especially if it's like an older person that might be the same age as my parents, I'll take a step back and say, would I do this to my dad? Would I do this to my uncle? Absolutely. And I've said this to patients too. I've had patients ask me, would you do this to your dad? And I'm like, absolutely, I would. I wouldn't say anything different to my own father.
Yeah.
And I think that's very important. That's me. That's my philosophy.
Yeah. Well, no, I think that, like I said, I think that that's a big contributor to your success, and in particular in that fee-for-service environment. Oh yeah, because again, way more willing to pay for something that I perceive to be particularly valuable, and that's the perception I'm gonna have, I should say, if I feel comfy and at home, and that you're giving me the same advice that you give your dad.
Like I said before, as a periodontist, I'm not well loved, and I get that, okay? So for me to make sure that patient is comfortable and at ease, and that they are totally experiencing what I would want, that's where all the patient experience aspect, like it's so important. If that patient is happy, everything else will fall into place. Everything else. But if that patient is not comfortable, is not happy, it doesn't matter what you do.
Yeah.
It's not gonna work. And it bothers me when a patient, and I can't make everybody happy. I get that. But it bothers me when I do have an unhappy patient, and I will do whatever I need to do to make that patient happy.
Yeah. No, and so I really like that answer, because what stood out to me is I hear you constantly putting yourself in your patient's shoes. And I think that's a really successful technique for any business, because if you look at the most successful big giant corporations and you look at really successful independent small businesses, the one common thing that they're always going to have is they're focused on putting themselves in their patient or their customer's shoes, and understanding what the experience is like to receive. What kind of service am I delivering? What is it like to receive the service that I'm providing? And that, as your guiding light, I think really does help the money follow, because we're more willing to pay for things that we're satisfied with, that bring us joy. If it's comfortable and I want to come and it feels like coming home, then I'm going to be way less apprehensive to schedule the rest of my treatment and to get those things on the books. I don't mind coming back here.
That's all I do. I focus on that patient 100%. That's all that matters to me.